A Guide to a Good Night's Sleep. The average Brit gets just 6 hours and 20 minutes sleep a night, with 48% of the nation believing they are not getting enough. It's no surprise then that 23% of us would do anything for a good night's sleep. These are some of the common things people do wrong when trying to fall back to sleep, and what they should do instead. 47% stay in bed and try to fall back to sleep. Lying awake teaches your brain that bed is a place for wakefulness, not sleep. If you're awake for more than 20 minutes, get up and do something until you feel sleepy again. 22% check their phone. Using your phone at night for scrolling, social media, or even just checking the time can activate your mind at a time when you need it to relax. Try to avoid phone usage overnight and give your mind a chance to properly unwind. 21% lie awake worrying or thinking. Racing thoughts keep your nervous system on high alert. Try writing worries down earlier in the evening to help your brain switch off at night. 12% watch the clock. Clock watching increases anxiety and makes sleep feel harder to reach. Turn the clock away so you're not tracking every passing minute. 9% try reading or watching something on a screen. Winding down can help sleep, but it's important to ensure the content is relaxing and not overstimulating the brain. Sometimes reading a book or Paperwhite screen or a basic tabletop activity make the best distractions. On top of this, 10% drink alcohol to improve their sleep. Alcohol may make you feel sleepy, but it can disrupt sleep later in the night and make it less restorative. Reducing drinking and ensuring you have off days can help improve sleep. Even one disturbed night is enough to throw the body off balance, with those living with diagnosed health conditions the worst affected. Medical cannabis may be considered on a case-by-case basis for those who have not responded sufficiently to traditional treatments, or when those treatments are not appropriate. The decision to start medical cannabis in this setting is restricted to specialist physicians and needs to be supported by a multidisciplinary team. You can find out if you're eligible for an appointment to assess your suitability for medical cannabis by visiting the Curaleaf Clinic website today. For more information, visit www.curaleafclinic.com.